right, good morning. Do I need to use that as well? No? Okay. I don't think I need the microphone. Ready, guys? Okay, good morning, everybody. My name is Nancy McBrady. I am the Deputy Commissioner of the Department of Agriculture, Conservation, and Forestry, and I'm very pleased to welcome you to today's panel at the Ag Trade Show regarding navigating health insurance in Maine. A goal of our department is to help Maine producers access affordable health care coverage. We know that many farmers are underinsured, not insured, or may have a spouse that works off farm in order to get insurance for their family. Over the past several months, our department has been reaching out to a number of partners with specialized expertise to help us understand the current health insurance marketplace. Our goal is to provide key information to the agricultural community that may help increase the number of Maine farmers with affordable coverage. In particular, we want to increase awareness of the availability of premium tax credits and cost-sharing reductions that farmers may be eligible for depending on their adjusted gross income in Maine. We understand that at least 80% of all Maine residents are eligible for some level of premium tax credit, and we suspect many farmers are not aware of this. Our presenters today will describe the coverage options available in Maine through its health insurance marketplace, including eligibility and enrollment specifics for Cover Me plans and Maine Care. They will also focus on gross income calculations and how those can affect eligibility for premium tax credits. We recognize that this is a very complicated topic. Fortunately, representatives will be on hand throughout the day today to speak with you individually to help answer coverage questions, and I believe we have handouts with additional important coverage details, and there is a booth right by the main entrance as well, which is great. Our speakers today will be Hillary Schneider, Director of the Office of Health Insurance Marketplace at the Department of Health and Human Services, Rachel Collmore, Consumer Assistance Program Manager at Consumers for Affordable Health Care, and Philip Doucette, a partner at Austin Associates, an accounting and advisory firm well known to ag producers in Maine. And with that, I'm going to turn it over to Hillary to get things started.
Thank you. And I'm just, if you guys can just pass those around. Those are copies of the presentation. Can everybody hear me? Or do I need to use should I use the mic, or can you hear me? Oh, good. All right. So again, my name is Hillary Schneider. I am the Director of the Office of the Health Insurance Marketplace, also known as CoverMe.gov here in Maine, and we are the official state-based marketplace. And so I'm going to just give a little bit of an overview of CoverMe.gov today and talk a little bit about eligibility and how you enroll. A little bit, I'm not going to go into details about tax guidance, very high-level overview because you'll hear more about that later. And we are happy to take questions at the end, or if anything's stopping you from understanding, just interrupt me. So what is CoverMe.gov? We are a we are not an insurance company. We are a marketplace, similar to any sort of marketplace where you, like a travel marketplace where you can compare different prices of flights. We are a marketplace. But one of the important things of why we exist is we are what I like to call a bridge, or a piece of the health insurance landscape puzzle. So we help bridge gaps in coverage for people who may be, they may have been on Maine Care coverage and then picked up some extra hours or made more money and they no longer qualify but can't afford the full cost of private health insurance. Somebody may want to retire early and doesn't have access to Medicare yet. We are a bridge for people who want to go out on their own and start a business on their own, start a farm or a farming business or agricultural business, or if you lose job-based coverage, or if your job-based coverage is not affordable by the standards set by the federal government. So we are a bridge and serve a puzzle. We're a puzzle piece in that healthcare landscape. So as I said, we are a one-stop shop, primarily an online platform where you can shop for and compare health insurance plans. So this is a screenshot of what it looks like when you use our anonymous shopping tool. You can actually go in and don't have to set up an account, but anonymously look at what the plans look like before you set up an online account, and it would give you, you can select some plans to compare side by side. Tries to make it more easy for you to compare plans on an apples to apples basis. And this is only a small subset of what you can actually see. There's lots of things you can compare plans on. So what is important in your, whether it's important for what that monthly premium amount is going to be, whether you care more about what you pay when you show up at the doctor's office. If there are certain prescription drugs you take, you can put them into the system and it will show you whether they're covered. You can put your healthcare providers in the system and it will show you if they're in network or not, or out of network, what it would cost. Your hospitals, if you're expecting some, like a knee replacement surgery, there's some procedures you can put in to also see what it would look like. And the Plan Compare tool uses an algorithm that actually shows you in a good year where you don't have a lot of healthcare needs, in a moderate balanced year, or in a year where you have a lot of healthcare needs. So you can compare plans based on that. Why should you use CoverMe.gov? It's the only place in Maine where you can go to get financial savings, to apply to get private health insurance coverage. So as I said, not only do we have this comparison tool that makes it easier for you to shop for coverage, but we can actually provide you with access to tax credits that lower your monthly premiums, and for some people also lowers your out-of-pocket costs, including your deductibles, your co-pays, and your co-insurance. And in fact, 85% of our enrollees get some form of financial assistance, and 40% pay less than $99 a month for comprehensive quality coverage. When you come through CoverMe.gov, we also, when you fill out an application, we actually look to see whether you may be eligible for Maine Care coverage too. So we're part of this no wrong door concept. If you do qualify for look like you qualify for Maine Care, and I say looks like because our eligibility criteria is slightly different than theirs, because nothing can be easy. That's a federal law, and so we will send you over to the Office of Family Independence for them to determine if you qualify for Maine Care, and if you don't, you can come back to us. Also, as you likely know, especially in industries and businesses where there may be some risk involved, health insurance is a peace of mind. And you know, when you go to CoverMe.gov, you are getting quality coverage from licensed insurance companies in Maine. So you don't have to, a lot of scams out there, you know that CoverMe.gov is legit. So who's eligible? You must live in Maine. You must be a U.S. citizen or lawfully present to live in the United States. You cannot be incarcerated. You cannot be eligible for Medicare coverage. There's a couple little nuances to that, but most people are not eligible for coverage, are not eligible for CoverMe. And you can't be eligible for coverage from another source like Maine Care or an employer-sponsored plan to be eligible for financial savings. So if you have those two categories, you can still enroll with us, but you won't get financial savings. Our plans, as I said, are from national and regional private insurance companies licensed to do business in Maine. You can see them here. We also provide standalone dental plans from two carriers, Delta Dental and Anthem. Quality comprehensive coverage, as I said. All plans are required to cover what's known as 10 essential health benefits, which include preventive care, as well as office visits, hospitalizations, prescription drugs, mental health and substance use disorder, pretty much anything you could possibly need that is traditional medicine is covered through our plans. And individuals do not pay co-pays, co-insurance, or deductibles for certain preventive healthcare services, as long as they're provided by network providers. And here is some of the examples of the free preventive care. So again, as long as they're delivered in network, this is the types of preventive care you can get pre-deductible with no out-of-pocket costs. If you go to that link, you can see a longer list of benefits. The Maine marketplace plans also have some additional coverage. As long as you do not have a plan with a health savings account, there are federal laws that restrict what you can provide through those. But if you don't have an HSA plan, you also get 3 primary care visits and 3 behavioral and mental health visits without having to meet your deductible. That first visit is $0 out of pocket, and the second and third visits have a low copay. Depending on the plan, it ranges from $20 to $50. So pre-deductible, you get all that preventive care in 3 primary care and 3 behavioral health visits. Pediatric dental is also included in all of our health plans, and again, you can buy adult dental as a supplement or a standalone policy from 2 of our carriers. This is a little bit more information about the financial savings that we offer. One is called advanced premium tax credits, and that's exactly what it is. It's a tax credit, but unlike other tax credits, you get this in advance. You can get this in advance, meaning it applies on a monthly basis and lowers the amount of premium that you have to pay. So it is estimated based on your household income, and then our enrollment system tells you exactly how much you qualify for, and then that comes out of the amount that you have to pay your insurance company every month. And then alternatively, if you don't want to risk it, because there is a reconciliation process, which we'll talk about later, when you file your taxes, and if your income is very variable, some people choose to take that at the end and not take it throughout the year. The other thing is some people qualify for cost sharing reductions, a smaller amount of people, and that lowers your out-of-pocket costs, like your deductibles and your co-pays and your co-insurance, but you have to enroll in what's called a silver category plan in order to get those cost sharing reductions. And here's an example of what that can mean. This is based on an actual example. A family of 3 in Caribou has an annual household income of $78,500. If they did not buy insurance through the marketplace, their plan would cost them $2,004 a month. They qualify for over $1,600 in financial premium savings, and so they pay $395 a month, and their deductible is $3,500, but they get all that pre-deductible coverage too. You have this in your packet, so you can take it home and look at more, but this is the income ranges that qualify you for premium tax credits. And so what the law basically says is that you shouldn't have to pay more than X percent of your household income on health insurance. And so that varies by income, but even people that make over $60,240 a year as a single person will qualify for premium tax credit if that premium is more than 8.5% of their household income. This is also the qualifications for if your employer plan is affordable. So if your employer plan is more than that, you can get you can buy coverage through the marketplace and get tax credits. The good news about people, especially people like in agricultural community or other communities where income can be variable throughout the year, people can feel like that's a risk, that they may end up making way more than they expected and then have to pay money back when they reconcile their taxes. There are upper limits on how much you have to pay back. Really, the easiest way to avoid paying back anything at tax time is if you find your income is different than what you expected, to just come in and keep updating your enrollment in the enrollment system, and we'll recalculate the premium tax credits and apply that to your plan. But these are the limits that you would pay, that you have to pay in reconciliation of your taxes. So some of the most important things is we have an open enrollment period, so you can't enroll at every time of the year. The important thing is actually our deadline for February 1st coverage is tomorrow, January 15th. So we have a call center that I'm going to have the number later. You can call. They're open until 10 p.m. Tomorrow. But you can go online, and we have folks here today that can help give you more information or help you enroll. There are qualifying events, life events like the ones listed up here, that qualify you to come in and get coverage at any time during the year. There's more information on our website as to like how many days you have to get coverage during those special enrollment periods. Bunch of ways you can get help and get coverage. Again, coverme.gov is our website. There are local free help throughout the state, either from brokers or from Maine enrollment assisters. You can find a list of those if you go to coverme.gov/local help, put in your zip code near where you live or work, and you can find people in your community who can help you for free. We also have a toll-free 800 number that is available 8 to 5 Monday through Friday, but then has extended hours closer to deadline, so extended hours today and tomorrow till 10 p.m. And then you can also find, as I said, brokers. There's a couple slides here that I'm not going to go into more detail. You can look at more, but if you have employees, you can also do, there's a couple of arrangements you can do to provide them with health coverage through us. So there are, there's some small business healthcare tax credits that you may be eligible for, and I list some of the pieces on that and where you can get more information. And then there's also what's known as ICRAs or QSARAs, which are health reimbursement arrangements, which means you can give an allowance to your employees that then they can use to buy health insurance through the marketplace. And so that has tax advantages for both the employer and the employee because those are pre-tax dollars. And again, there's some information up here and more information at the links that I put in the slides. And then there's even more information on the small business options on our website, on the IRS's website, and on healthcare.gov. And you can Google those words and the site should come up. And then this is just a reminder that, you know, I think a lot of people think, especially if you're young or healthy, that you can go without coverage or you can buy a GAP plan or another plan. But remember, a lot of the GAP plans or limited benefit plans don't cover, a lot of them don't cover emergency care. If you end up with an unexpected illness, God forbid a cancer diagnosis or something, that can be really expensive. Emergency departments are only required to stabilize your care. They're not required to treat your care. So please check us out if you need health insurance and spread the word. Thank you. And now Rachel's up.
Can hear me over the World Wide Web, right? Okay, so I'm a mom. Actually, Hillary is too. So I shouldn't have a problem projecting my voice so you guys can hear me. Let me know, though, if it does turn out to be a problem. So I am a part of a nonprofit called Consumers for Affordable Healthcare. So we are designated by the Maine Attorney General's office to help all Mainers navigate all types of insurance. So CoverMe is part of that. So it's on there. We are not an insurance company. We are not a government agency. My slide looks a little different than I thought it was going to look, but that's okay. We'll roll with it. So I'm going to talk about MaineCare. I'm going to talk a little bit about Marketplace. Some of it might overlap a little bit with Hillary, but it's complicated stuff, so maybe that'll just help drive the points home. And I'm also going to talk about what's called free or discounted care. So Maine's Medicaid program is MaineCare. So it is a no-cost or low-cost health coverage that pays for doctor's visits, hospital care, prescriptions, and more. It does cover dental for both children and adults. The adult part is new. It is based on family size, your current monthly income. So that's something that Hillary was talking about. When you go to Cover Me, they're going to look at your annual income. MaineCare is based on your current monthly income. And for self-employed individuals, people with business, like that income ebbs and flows, right? So if you're applying for MaineCare with that kind of financial situation, MaineCare is going to look at your annual income and they're going to divide it by 12 and get an average monthly income. So, like I said, family size, current monthly income, immigration status, and other factors are used to determine that eligibility. Pregnant persons and children may be eligible regardless of their immigration status as long as they meet the income guidelines. And you can apply for any time during the year, so there is no open enrollment period for Maine Care. This is information about how to apply. I wasn't as prepared as Hillary. I didn't bring copies of my slides, but I do have tons of handouts. So you can apply online at mymainconnection.gov. If anyone has used online to apply for Maine Care in the past, like way past, they have a new site. It's way easier to use than the old one. You can download a paper application from this link, which obviously you can't click on, but we can help you out with that. Or you can email one to Farmington and mail in. You can also go in person to your local DHHS offices. Any of the information that shows up on these slides, and if you need it, just ask me and I will get it to you. Oh, that's not my slide. Answering questions about me, maybe it is my slide. I don't know. Some of this Helen put together, so I apologize. So marketplace at coverme.gov. So like Hillary said, it's health coverage that pays for doctor's visits, hospital care, prescriptions, and more. Very similar to Maine Care. Most people can get help paying for it. Again, family size, income, immigration status, and other factors help to determine whether you're eligible for those tax credits. Enrollment happens once each year, November 1st to January 15th. Sometimes those dates are a little fluid, but really those are the dates that you can count on being it. Some life events can open what's called a special enrollment period, which Hillary touched on, and you apply at coverme.gov. This slide is really tough to read. I'm not sure what happened here. Could you? That would be really great. We're gonna. That's cool image, yeah. Like, I'm afraid of heights. Like, that will never be me. I hope that they have health insurance, though. Maybe we can just go back to the other one, and I'll try and wing it a little bit. Yeah, that's okay. I appreciate you trying to help me out, though. Oh, that one. Back. Yep, next. I gotcha. Whoops. We'll fight over where it goes. So CAKE's at Maine Enrollment Assisters. So on staff, we have certified Maine Enrollment Assisters. And we can assist you with marketplace coverage by screening you for those premium tax credits and other savings, those cost sharing reductions. Seeing if you qualify for a special enrollment period, right? If you're outside the open enrollment period. Helping you complete and submit an application. Helping you shop for plans and enrolling in coverage. And screening you for employer-sponsored coverage affordability for individual and family plans. And we can help you navigate those QSARAs and ICRAs that Hillary was talking about, and I'm sure Phil maybe will touch on. I don't want to put him on the spot. But there are some things that you need to think about if you are eligible for, if you are offered one of those, how that works with Marketplace. Is there anything else in the bottom there? Okay. Oh, this is so much better. Okay. So finding a plan that works for you. So let's say you are, as soon as you leave today, you're going to go to coverme.gov and you're going to start looking for a plan, and you're like, I get it, I need some help. You call coverme.gov. One of their amazing call center reps helps you complete your application. What they're going to do is you're going to say, okay, now I need to pick a plan. And they're going to say, okay, you can call Consumers for Affordable Health Care, and they can help you. So this is something that we do. We help you not only complete that application, but we can help you walk through that plan compare tool that Hillary was talking about. So you can choose the plan that's best for you. Here again are all of those carriers that Hillary talked about, minus the dental plan. But you can use the plan compare tool to enter all of your doctors, your primary care physician, your specialists, you name it, mental health providers, the hospital that you use most, or a hospital that you know you're going to have a service provided at, and all of your prescriptions, and use that to determine, based on what the premiums are for that plan, what your household budget is, and what you know you need covered. So there are 5 plan levels available. I'm going to run through this pretty quickly just because it's a lot to absorb, and you can call us back. But there are catastrophic plans. Those are they're not eligible for tax credits, and they're only eligible to a small section of the population. But the ones you're going to see are bronze, silver, gold, and platinum. And the way they work is the bronze plans have the lower premiums and the higher out-of-pocket costs. So for example, I have a 21-year-old son, and he's pretty darn healthy. He is a lobsterman, so there is some risk involved with what he does. But we got him hooked up with a bronze plan, right? Because we know he's not going to need a knee replacement. He's not on any medications that he needs to take regularly. My partner, however, is 45, right? So some things are starting to happen. So he's more of like a silver level plan. That's a choice we made within our household, but that's an example of families trying to balance premium costs with out-of-pocket costs. And without a crystal ball, you got to do the best you can, and that's the chance that we're willing to take or not willing to take, depending on which side you're thinking of. Like Hillary said, though, first primary care visits, those are free. First 3 behavioral visits, you can see first visit is free, second, third. So these plans, you really need to dig in and look at them to make sure you're getting the best bang for your buck, but know that some of this is going to be covered. I think we call it like first dollar coverage, right? Isn't that what we call it, Hillary? Yeah. So, okay, where am I going? Okay. So, where did my main care slides go? Huh, what happened? That's okay. I'm gonna wing it. So, ignore the slide for a moment. So, to talk about Maine Care, like I said at the beginning, Maine Care is based on family size, household income, but there are different categories within Maine Care. So adults are eligible up to a certain income limit. Children are eligible up to a higher income limit. Pregnant persons are eligible up to a higher income limit. So there may be scenarios where different people in one household are eligible for different types of coverage. I'm going to use my household as an example. I have employer-sponsored coverage. It meets the affordability test. Therefore, that's the plan that I have. My partner, as I said, he has a marketplace plan. My children are covered by the Children's Health Insurance Program, which is a program within Maine Care. And that is because the income limits for the Children's Health Insurance Program are pretty generous for the state of Maine. So that's where Consumers for Affordable Healthcare can come in and help you kind of, it's like a game of Plinko, right? Like you drop each person in your household up at the top. You guys remember Plinko, right? Like, okay, phew. Jeez Louise. And you kind of bounce around and then you end up in your healthcare bucket. So that's something that Consumers for Affordable Healthcare can help you navigate. So hospital free care is not health insurance. Hospital free care exists through all of the nonprofit hospitals in the state of Maine for people who find themselves either uninsured or underinsured and have major medical expenses that they need help paying for. So it works with private insurance. There are income limits, but it covers medically necessary care at any Maine hospital and its affiliated practices for emergency room services, prescription drugs, physician services, lab services, urgent care, and services provided as part of a hospital. Again, eligibility is based on income, so that's and it varies by hospital, but the lowest amount for a single person that you can earn, let me rephrase that. At a hospital, some hospitals are higher. I don't know how to explain this without it being wonky, but $22,590 for a single person, $46,800 for a family of 4. So you must have a medical bill from the hospital or its affiliated practices to apply. You can have health insurance and use free care. You call the hospital's billing department to apply, or you can call us for help with that. If anyone is interested in that, please reach out to us and we can give you a list of all of the different income limits at all of the different hospitals for you or someone you might know, or just to have on hand in case you need it. Discounted care. So there are a lot of really great qualified qualified federal health. Can you help me out, Hillary? I'm going to phone a friend. Thank you, federally qualified health centers that have sliding scales, so you can go in there. They can help you navigate all of your health insurance, and most of them provide dental care, which is really incredible. So you can see some offer fee for service. They do have limited hours and eligibility. Eligibility for services is, again, like so many things, based on family size and income. If you need help finding one of those, you can call us. They are all across the state, and they're in some pretty great areas where there are some healthcare deserts, so to speak. The other thing we do is private insurance appeals. Sorry you can't see this. I can barely see it. So we help people who are being denied coverage for care. So if you are, you go to your doctor and your doctor says you need an MRI, and your insurance company says, we don't think it's medically necessary that you need an MRI. We can help you identify why that has happened, and if it's something that, whatever fix it is, point you in the right direction, or go ahead and advocate on your behalf. So I wish I could read those, but I'm...
Prior authorization denial.
Thank you.
Coverage denied for procedure. Test or
Doctor something, yeah.
coverage variations due to network limits, I think. Assistance that may be provided from Consumers for Affordable Healthcare. Instructions on the appeal process. Instruction on carrying out first level appeals, helping consumers with second level appeals at external review, help with filling a complaint with the appropriate agency, and help with navigating provider billing departments to resolve billing issues.
Thank you, Hillary. So and that can be really hard, right? So even once you've got health coverage, it doesn't mean all the barriers are down. So if you have questions about your coverage, we are here to help. You can call our helpline at 800-965-7476. It's a good thing I know that one by heart. Helpline at mainecahc.org. So we're Consumers for Affordable Healthcare, but we call ourselves CAHC. You can go to this website or go to our website, and you can complete a fillable form online and send it in, and one of our helpline advocates will respond to whatever question you have. Uh-oh, Phil, I don't know if you've got any slides up. Or, okay. Okay, ooh. So, questions about coverage. Oh, so just a real quick thing. CAHC does a lot, but we do not assist with Medicare. We can help with the Medicare Savings Program, which is a program within MaineCare that helps people with Medicare pay for some of the costs associated with Medicare Part B premiums, co-pays, things like that. And we do not help with long-term care services. So we recommend the area agencies on aging for all things Medicare related that aren't the Medicare Savings Program, and refer people to the Ombudsman for long-term care services. That's us. A big thank you. I'm sorry my slides weren't perfect, but I do have materials up here, so if anybody has any questions, please do not hesitate. And certainly beyond general questions, if you have an individual household question, I'm happy to answer that for you. So, see there, what's going on here? Oh, this is you. I was like, what? There you go. That's okay. That's okay. It happens. Thank you. That would have been embarrassing.
All right, I have some slides up here too. I've printed copies of that if you're so inclined. So my role in all this comes kind of long after you've used these wonderful resources and you're at the point where, all right, I've gotten health insurance all year. I decided to take part in this advanced premium credit. What does that mean for me now? How does that work? Hillary kind of ran through a quick example of how it works, but essentially, when you sign up for health insurance, you can get this premium tax credit. And unlike a lot of other tax credits, you don't have to wait until your tax return, because it's nice. They can say, hey, look, you've signed up for this health insurance. Your premium is $2,000 a month, but we're going to give you a credit of $1,600 a month, so you've really only got to pay $400. Well, if they said your premium is $2,000 a month, we'll give you a credit, but you've got to wait a year plus to get it on your tax return. Not really going to be affordable. So they let you get that credit ahead of time based on the information you provided. So they're going to ask for all the stuff we mentioned earlier. What's your income like? And I highly recommend what Hillary said. If it changes during the year, up or down, contact them and get that updated. It'll adjust your premium, but it'll make it a more accurate number when you get to the end of the year. So when you've got, at the end of the year, so you go through that, you give them your information, you're paying a smaller premium throughout the year, getting this advance credit on what you've given them for information. This is Form 8962, which I'm not going to get into these details. And by the way, anything tax related, anything I say, I'm not going to say it every time, but it's always a big fat, it depends. Because every situation is different. I'm going to give you a broad kind of walkthrough of how this works, but you'll have goofy things that may pop up in your own situation. But this is the form where that gets reconciled. This top part reconciles your income, where your income fell on your tax return for you and your family, and how that compares to the federal poverty line, because the repayment of the credit or any potential credit, additional credit that's coming to you, is based on how that relates to the federal poverty line. And this part below shows what your premiums were during the year, how much credit you got during the year, and how that compares to this benchmark plan that they have. It's a whole thing. Not really worth going into it today, because we could spend all day on it, and it would be the most fun you've had in 2025 so far. So that gets reconciled to form on your tax return. You can get a deduction for this depending on what your tax return's like. If you're an individual, the amount that you've paid during the year, plus any additional credit you may have to repay, those get lumped together. If you're an individual, it gets deducted on Schedule A, subject to all kinds of limitations. But if you're self-employed, regardless if that's as part of an entity or a sole proprietor, you can get a deduction for that on the front of your return, not subject to the same limitations as if you were itemizing, but you can have it as self-employed health insurance deduction on the front of your return, again, subject to different kinds of limitations. So the way this is figured, this is just a quick snippet as when they say, well, what is your income? The income they're talking about is this modified adjusted gross income. And modified adjusted gross income throughout the tax code is about 47 different things depending on what it is you're doing. In this case, it starts with your adjusted gross income on your tax return, and it adds back for a few things. The one you're most commonly going to run into is if you receive Social Security, your Social Security, the full amount of it won't be taxable. It may be a little bit taxable, it may be a lot taxable, but there's a difference between the amount you receive and the amount that's taxable. That difference gets added back to arrive at your modified adjusted gross income that's used to figure how good you came out when you were calculating what your credit should be. So I said it's based on how you compare to the federal poverty limit. This is what that federal poverty limit is compared to for your family size. Family size of 1, 2, 3, all the way down to 8. And you can see if you have more than 8 in your family, you can adjust for that. These numbers are important, as we'll show you. I put together a few examples of if your income comes out, how it comes out in relation to these poverty lines, what that means for your advanced credit you may have received. So here, if you got an eagle eye, you'll notice that this chart is a little bit different than what Hillary had earlier. That's because in the tax world, we're always a year behind. Right now, for the next several months, I'm going to say this year, and I'm talking about 24, and sometimes it's confusing to people, because we're always a year behind. In 2024, which is the tax returns that are going to be getting prepared now and the next several months, these are those, the caps. And the caps are, this is where you fall in relation to that poverty line. So the hundreds is percent. So if you're less than 200% over the poverty line, you're going to be limited in what you have to repay. If you're single, it's $350. If you're married, it's $700. If your income is in relation to the poverty line, between 200 and 300%, those caps are a little higher. If you're up to 400%, the cap's a little higher. Once you get to over 400% of the poverty line, there is no cap on what you may have to repay. And that's important, as I'll show you in these examples. The first example, I can go back, right? Yeah, the first example is a married taxpayer is a family size of 4, their adjusted gross income is $70,000 for the year. So the federal poverty line for a family of 4 is $27,750. So 70,000 is about 250% of that number. It's about 2.5 times that number. So since they fall between 200 and 300, skip down a dot, they receive $9,500 in advance premium credit during the year, but because their adjusted gross income falls between 200 and 300, they're going to be capped at what they have to repay at $1,800. So even though they were over by a lot, their excess was $2,500. They received $9,500 ahead of time. When they got to their tax return, they figured out, what should you have actually gotten? Your income ended up being a little different than what you predicted it to be a year before. You didn't bother to adjust it during the year because you thought you'd be pretty close. Well, you were over by a little bit. You should repay, or you're in excess by $2,500. But because you fall in these limits, you need to repay $1,800. And I always kind of explain that to people. The resources that are available now are much better than it was when this program first started 15 plus years ago. It was a little more the people helping and the people signing up. There was a lot of, we're kind of learning this as we go. So I would ask the people who would sign up, and whether realizing or not realizing, they'd say, oh yeah, my income, geez, it's probably going to be 80,000, but why don't I just say 40? That way I'll get a good credit and I'll worry about it later. Well, the worrying about it later was having to repay this credit. And depending on how far off you were, maybe that wasn't too bad. Like in this case, you may be thinking, all right, I got to repay $1,800. Well, that's $1,800, or in this case, it's $2,500. I got $2,500 more in credit than I should have, and that saved me throughout the year. I paid a lot less throughout the year. Now I got to pay back $1,800 of that. I don't mind that because I got a deal overall, but you do have to repay some of it. In this next example, not such a great scenario. This is a family of 5, but modified adjusted gross income of $130,000. The federal poverty line for a family of 5 is $32,470. It's just over 400%. 400% of that number is $129,880. These people are at $130,000. So if you go back to my slide about the caps, they're over 400%. There is no limit on what they have to repay. So in this case, they received $18,500 in advance credit. It should have been $11,000. So they would have to repay this entire $7,500 because there is no cap. But this is where having a really great tax preparer or anyone knowing how this works, even the folks over here can help you out with this part, is knowing where you're falling. Because you are just over that limit. If you're getting your taxes done in February and you're realizing that, geez, my income is $120 over this cliff that is making me repay $7,500, you can still do a handful of things now in 25 to affect your 24 tax return. A good example is contributing to an IRA, a traditional IRA, if that works for your situation. So if you are $120 over this limit, you put $200 into an IRA, that's going to get you just below that 400%, which means you'll still have to repay, but instead of paying the entire $7,500, you're going to hit this cap of $3,000. So still $3,000, a big amount to repay. Again, you got a really sweet deal all year long on your advance credit. You've got to repay some of it now, but because you put $200 into an IRA, you're repaying $3,000 instead of $7,500. So that doesn't always, I mean, that's kind of like a perfect situation. I made it come out so it's that close, but I've seen those kind of things where it may not be a couple hundred, but it's 500, 800. It's not a ton compared to what you may have to repay. So be aware of that if you ever run into a situation. And it could work too. It could work just as well if you're in one of these where you may be just over 300 and you put a little money into something like an IRA and you go down to the next cap level. So it's just something, knowing how this works is really helpful. And again, I had a handful of people when this first started, there was no idea about how this worked, and people would be over that $400 limit and have to repay, some cases, I mean, $11,000, $12,000 of premium tax credit, which again was great at the time, but having to write one big check now, it'll be hard to remember those savings you had, 13, 14 months ago. And this last example I have is it can work the other way. You're not always repaying the credit. This example, a married taxpayer is a family size of 4, modified adjusted gross income of $25,000. The poverty line for this family of 4 is $27,750. They are under the threshold for repayment. So in this case, they received $9,500 in advance credit. They actually qualified for 10. You will get the extra credit on your tax return as a refundable tax credit, which means even if you had stuff that got you down to 0 for tax due, you can still get this back as part of your refund. And I use $500 in this example. I've seen people get $3,000, $4,000 back depending on how far off they are. So the most important thing, you want to get it close. You want to be aware of if changes happen during the year. You want to be on top of that and update people on the marketplace to change your premiums. You'll be happy you did when it comes to the end. But like I said, this gets reconciled in your tax return. So if you're signing up now by tomorrow's deadline to start coverage for February, you're not going to be dealing with the ramifications of those numbers you gave until next year's tax return. So be aware of that. That's all I got. I think that's all we've all got. So if there's any questions, feel free to shoot them our way.
What Phil was saying, people call us and they're self-employed. They have a farm. They have, they make jelly. They do whatever, and they're like, "Well, I'm self-employed and I don't really know what my income is going to be like." Having a good relationship with a tax professional who can give you an idea, based on years past, based on any investments that you plan on making or whatnot. We're not tax professionals at Consumers for Affordable Healthcare, and neither are the call center reps at CoverMe.gov. So a lot of times we're going to say, that's a question for your tax professional. So having that good relationship, not even once you get to, time to file, but ahead of time, to be updating those numbers and have a good starting number is going to be really, really important.
Yeah, I've seen those situations come up where someone may have, the year is going about how they expected, but now they have an opportunity to, oh, hey, we're selling this piece of land and we have an opportunity to sell it this year or wait till January, or we can get half the payment now and half later, and they'll be thinking of this as, used to be it was just a tax consideration, like, well, how much tax am I going to owe? But now it's, well, I'm going to owe tax, and oh, by the way, you may have to repay some of this credit, so let's think about that. And I hear sometimes from really sharp investment advisors where people may have, on top of everything else they've got going on, they may have some money invested with someone, and that investment advisor is aware of, oh, geez, they've got some capital gains coming that they may not have been planning on. How does that work out? And they're going to be taking some money out. We can kind of have some control over what that gain is going to look like. How does that affect this health insurance piece? It's another thing to consider that wasn't around, I say, it's been a while. It's been a lot longer than you realize, but yeah, it's another consideration to make. So anytime you've got any kind of change and you're on, especially this, but there's other pieces of financial life too, be aware of this kind of stuff and not just, oh, I might owe tax, but I may have other things. You might have a lot of changes that get affected by that. So just be aware and reach out to someone if you need to. Yeah.
I have 3 comments/questions. The first is a question on coverage. Is this only for Maine providers, or does it extend to New Hampshire and Massachusetts as far as where you can
Yeah, for our plans, again, the best thing to do is to put providers that you're going to take in that shopping tool, or that you use in that shopping tool to see what networks they are. But yes, most of the providers, or most of the insurance companies, cover providers out of state. They may not be in network. It definitely differs among the insurance companies and can even differ year to year. So one of the things I didn't mention is if you are on CoverMe.gov and everything's all in order, you'll be automatically re-enrolled the next year. But you should always go and check and make sure that plan is covering the doctors and the networks that you're using. They even cover. It's not uncommon for these insurance companies to cover providers if you're traveling across, anywhere, but also traveling. A lot of Mainers will get specialty care for rare conditions in Boston, and I've heard that there are vast differences among the different carriers around who covers things like that best. So the ultimate source for the provider networks of the carriers where they're most updated is on their websites. But when you go to that shopping tool and you can put in your regular providers, it will tell you which ones are in network, which ones are out of network, and what you expect to pay for services or for an office visit with those.
And everything I spoke about, this whole reconciliation stuff, is a federal thing, so that's going to work exactly the same regardless of what state you're in. This doesn't affect your Maine return at all. I mentioned you can deduct stuff potentially. That's a federal thing that could differ from state to state, but the bulk of what I was talking about was reconciling your credit and everything else that's on your federal return.
And to touch a little bit more about networks, so Hillary is right. Using that plan compare tool, if you see a specialist in Boston, you're gonna want to list that specialist. Look for a plan. I think Maine being the state that it is, our provider network, I'm not going to say in general, but in some cases does kind of extend over state lines a little bit, especially when it comes to we call them super specialists, right? That there is no provider in Maine who can provide that. And sometimes, if you are seeking a certain kind of medical care and your provider says that they're not in network, if you can make an argument of network inadequacy, that is that there is no other provider in that network who can provide that care, you can make a request that your network carrier provide that care. And the same goes for Maine Care. Maine Care works, for example, Boston Children's, they're commonly covered by a lot of the carriers and Maine Care, Brigham and Women's. So but it is carrier specific, and you will want to reach out to that carrier, Maine Care Member Services, however you get your coverage, and know before you go, because that's going to be really important.
My second question is, when we transition from one spouse making money, not making any money, and then none of us are making money because we're going to be starting a farm, and we, in 1 year, if you look at our income for that year, could be $200,000, but really, we're already making zero, right? Because we're reflecting on the previous tax year. How, when we're looking at coverage, whether Cover Me or Maine Care, yes, historically, we were making money, and now we've both gone into the farm, and we're getting $20,000 a year. How is that calculated? Because if we're looking at historical data, it's like we could afford to have a premium plan on Cover Me, but in actuality.
So that's where thinking about how Maine Care works and how Cover Me works, and maybe even calling someone like Consumers for Affordable Healthcare to sort through what your specific numbers are. So because Maine Care is based on monthly income, let's say hypothetically, your spouse had a wage job, right? And you were just building up the farm, and now you've reached a point where he's going to leave his wage job and he's going to join you on the farm, and his wages are gone, right? That this new month, March 1st, he's no longer earning those wages, and your income, you have a significant drop in income. That could be an opportunity to move out of the CoverMe.gov bucket and into the Maine Care bucket. They're really, you're going to want to talk to your tax professional about that kind of thing, right? And you're going to want to reach out to someone who can help you figure out which bucket you're in now. But you can transition, and it's really helpful to have people like Cover Me and Consumers for Affordable Healthcare who can help you figure out where you are in that transition and what you need to do. Another thing to remember is you don't want to be enrolled in Maine Care and enrolled in Marketplace at the same time. If you are enrolled in Maine Care and you are accepting tax credits on the Marketplace, that's not okay. It's called dual enrollment, and you, like Hillary's slide said, if If you qualify for Maine Care, if you qualify for Medicare, you are not eligible for those tax credits, and you may have to pay some of those back.
So then this leads to my last.
So I have actually a little bit more on that. So marketplace coverage is based on your income. So the deadline tomorrow for 2025 coverage is based on your estimated income for 2025. Now we do income checks with federal. It's called the federal hub, but we're federally required to check, and so it may come back what we call a data matching inconsistency, meaning that it looks like your income is not what you said it is, but you can sign a form that's a self-attestation that says this is my income, or you can provide some sort of evidence that you are no longer making that income, and then your tax credits will you become eligible for them. So it's based on your estimated income for the plan year, not your last year's income. And then the other thing that's important to know is if you're one of our special enrollment periods is losing credible coverage. So if a spouse has job-based coverage and in February decides to transition to the farm, then you would be eligible for a special enrollment period if your household has lost job-based coverage. In addition, if for a while you qualify for Maine Care, and then your income becomes over the threshold for Maine Care, you would also be eligible for a special enrollment period later to enroll partway through the year because you've lost Maine Care coverage. So those we have a lot more flexibility in when you enroll if you are a lot of, we call it the churn between Maine Care and the marketplace, and you can go back and forth between those two throughout the year, and we do have members who do that.
Well, and that's my last question. So I lived in Massachusetts. Previous life I was a consultant. So some months I was making money and some months I wasn't. And I had from 1 year a 2-inch thick stack of paper because I was constantly ricocheting between the equivalent of Maine Care and Cover Me, open marketplace in Massachusetts. And it was so much work, and I never knew if my provider was going to be covered that month because they just kept kicking me in between these two companies. I really don't want to go through that again. So I don't know if that would be the same experience in Maine or if it would be maybe a little more seamless at this point.
I think the best way to try and avoid that scenario would be, one, having, like I said before, having a good relationship with a tax professional, right? That you can sit down with, and you can get a good idea of, what your income is going to look like, either based on years past, based on, what you can anticipate, and making a prediction. If you know that your income is going to be above, if you're reasonably certain that your income is going to be above a certain amount, and that it makes you eligible for marketplace, then you can go to marketplace and you can make adjustments. If you are reasonably certain that your income for the whole year, if divided by 12, is going to put you below that, you don't have to keep going on and off marketplace. If 1 month, or off Maine Care, excuse me, if 1 month you're above the income limit, but the next month you're significantly below, what Maine Care can do in a situation like that is use your previous year's taxes to get an idea of what your income was, divide that by 12, and that's how you'd become eligible. So that's a very, like Phil was saying, it's based on your individual situation. I can't say for sure, but if farming especially, right? Like when you're there are seasons where or parts of the season where you make more money, and there are dry seasons where you're living off what you made, and there are ways to kind of even that out, right? To look at an annual amount, whether that's marketplace, which uses annual, or even when it comes to Maine Care, using that annual amount to get an average monthly amount. Does that make sense?
It does. In Massachusetts, it was automatic. I wasn't doing anything. It evaluated me every month and was like, oh, you made too much money this month, so we're now pushing you over here. And then the next month they said, oh, you didn't make enough, we're pushing you back over to Maine Care. And I did nothing other than just get 2 inches worth of paperwork.
Yeah, I don't see that happening in the state of Maine. Yeah.
The other thing I'll say, having lived in Massachusetts as well, is Maine, and it ebbs and flows every year. I mean, a lot of times, a lot of these insurance companies, because there are so few providers in Maine, some of these plans are covering just about any provider. Now, that's you really should, as I said, fill it out in the plan compare tool to see. But you could also avoid some of these issues by, I would say, every major hospital every hospital in Maine takes Maine Care, I believe. And so, and most the hospitals are going to be in network with the. If you live in a community that has 2 hospitals, that may not be the case for Cover Me, but most of I think most of the plans cover all the hospitals in Maine. And I think the areas where you can find the most provider differences between private insurance and Maine Care might be some primary care providers may not take Maine Care, so it would be good to make sure if you are finding yourselves transitioning and you don't want to worry about your provider networks, making sure your providers take Maine Care, and then also checking out that tool on Cover Me. Mental and behavioral health is another place where you're seeing more providers not take Maine Care. Sometimes they're not taking any private insurance, so you want to be sure about that. Dental is also sometimes the challenge if you were transitioning between Maine Care dental and a dental plan. But you could avoid some of those provider network issues, I'd say, by making sure the providers you're seeing take Maine Care, and by making sure the plan that you're in CoverMe.gov takes those providers as well. But I'd say networks are more of an issue in the larger states because there's just a lot more providers, and insurance companies could have smaller networks. There are some plans that have smaller networks so they can make the plan more affordable, but in the most case you're finding you find less of that here.
There are major hospital systems across state. Probably the most common one we hear of is like Maine Health, Maine General, Northern Light. If you are working with a provider under that hospital system, if that provider is enrolled in Maine Care, generally speaking, or if that hospital is generally speaking, the providers that work under them are as well. So where you're really going to find issues with network coverage between the two would be private practice, not associated with a hospital, specialty offices not associated with hospitals, because the major hospitals in Maine all accept Maine Care, and are generally in network for at least 1 or 2 carriers. So that's another thing to think about, making sure your PCP is associated with that hospital system, because that's going to decrease the likelihood that someone's going to be out of network if you're moving between coverage options. And applying for hospital free care is always a good idea too, because that's just covers you.
Any other questions?